Hi, welcome everybody to our 10th annual Women's Health Forum. I'll explain why we got confused about 9 and 10, but today we're focusing on global women's health. And I do want to acknowledge that this is a partnership of the Wisdom Center, which I'm going to tell you all about in a moment, and the Department of OBGYN, Obstetrics and Gynecology, with Leslie Subach, who is a chair and has something came up that she actually had to do, so she can't be here, but she's welcoming everybody. And Michelle Berry is actually going to be presenting one of the plenary sessions at the end of the day, so she will be here as well. But that's also the Stanford Center for Innovation and Global Health. So they are the co-sponsors. Oops. Going the wrong direction. And what I want to do is just tell you a little bit about the Wisdom Center. So this is Women's Health and Sex Differences in Medicine. I'm Marcia Stefanick, Professor of Medicine at the Stanford Prevention Research Center, also Professor of Obstetrics and Gynecology, and Director of the Wisdom Center. And T.O. Pricing was outside. You got a chance to meet her. She's the Assistant Director of Operations. And Sophie Graham is also outside. She's our Program Associate. And for some of you, you know, she's TAing our new global health course. So the Wisdom Center was created by a 2-year strategic planning process that had a lot of really high-powered people from the medical school. And with these processes, you come up with a vision statement and a mission statement. So our vision is healthy women and men from conception through the life course, and most of our courses are life course based. And the mission is advancing human health across the lifespan through research and education in women's health, biology of sex differences, and gender medicine. So we have an educational mission, and we are one of the scholarly concentrations for the medical school, Women's Health and Sex Differences. I'm on the medical school curriculum working on sex and gender minorities and sexuality activities, and we have a lot of courses. So we now have created 7 courses for the medical school and undergraduates. Our newest one is Gender and Intersectionality in Global Health, which Clea Sarnquist is the course director for. I'm co-director, and she's the one with the global health expertise, and this is why we decided to have this conference today to really kind of acknowledge the beginning of this course. We also have something called the WISER community, which is the Wisdom Interdisciplinary Science Education and Research community, where we actually get to present some of the work that Wisdom is funding through these seed grants. We've been funding 4 to 9 seed grants for the last 5 years. And we have quite a bit of research going on, publications have been happening, so we feel like we really are stimulating women's health and sex difference research. Also for you to know, we did host the Organization for the Study of Sex Differences here at Stanford in 2015. This is a group that actually has a journal on the biology of sex differences. So if you do any kind of work in that area, that's at least one journal that you have a good chance of getting something published in. Also, we've been very active in sex and gender medical curricula work. There's been a group of people who have been trying to get this onto medical school curricula. I can tell you it's really hard. I've been trying very hard at Stanford, and the best I've done is set up a whole bunch of courses for undergraduates that medical students can take as well. But we did have our recent one last April at Utah on Sex and Gender Health Education Summit. So there is a group of people. These are in basically every school of medicine sends somebody to these conferences, and I've been lucky enough to go on behalf of Stanford. We also have an annual basic and translational research symposia on sex differences. This actually started before Wisdom happened, so this was something that the Cardiovascular Institute has been very interested in sex differences as well as women's health since it began. And back in 2010, we put on together the first conference called Beyond X and Y, where we had all 5 of the Institutes of Medicine, and we did in fact have BIRDS, which have WZ, so it was definitely Beyond X and Y. Then in 2012, we invited Vera Regetz-Zagrozic, who's the director of the Institute of Gender and Medicine at the Charité Institute in Berlin to present on molecular and cellular mechanisms of heart failure. She's one of the world experts in this topic. And then when Wisdom was created, we decided we'd start to do a series. We did our first one kind of on our own, and that was challenging. And we realized the best plan is to partner with the Institutes of Medicine. So in 2014, we did an Immunology Conference. All of these have the talks on our website. You can watch the entire videos of these, and we did bring some amazing people from other institutes, which is part of our goal, is to kind of bring people from elsewhere as well as present our own talent. So we did that with the Institute of Transplantation Immunology. 2015, we did cancer in partnership with the Stanford Cancer Institute. 2016, we did cardiovascular health, partnered with the Cardiovascular Institute. 2017, we did neuroscience, partnered with the Stanford Neuroscience Institute. 2018, we partnered with the Department of Genetics and did YX, sexy chromosomes, and we did had a lot of really good information on the X chromosome in particular, which is a very complex chromosome. And I do want to say it's not a female chromosome. Every single person that's alive has an X chromosome. You could not be alive without one. So it is very much it's a non-binary chromosome, but if you get two of them, you end up generally looking quite different than if you only have one. And you can have more than one, and you can have more than one X, but more than one Y. Won't go into that. And then this year we did sex differences from conception through puberty, partnering with the Maternal Child Health Research Institute. And then we've been doing these series, and the annual Women's Health Forum, the reason we got a little screwed up in our numbers, so for them, some of you thought it was the 9th, and now you're saying it's the 10th. We just didn't count right, and I'm going to explain why, because it's an interesting history. And again, all of these talks are on the website, so you can go back 10 years and see what people were talking about in women's health. So there was a program in OBGYN called Women's Health at Stanford that started this, and I was the co-director of that. Lynn Westphal was the director. And so we started the Women's Health at Stanford annual Health Forum. And in 2012, really before Wisdom completely was off the ground, but we had at least gotten the green light, we made that the inaugural Wisdom Forum. And then in 2013, we started getting themes, and we focused on cancer and survivorship and had Susan Love. And it was like a very big day in cancer because Jolene had just done her big event and basically had her prophylactic surgeries the day before. So everybody was aware that that was an important issue. 2014 was the Global Women's Health that we did. So we have done one before. We had Ruth Levine as our keynote. 2015, we did chronic disease prevention. That's my field, so I stepped up to the plate on that one. And then we tried something different. We tried to do precision health for women as a tract of the Stanford Health Matters. So it was our annual Women's Forum, but it was a very different kind of format. And it was an experiment to see if we could reach out to the larger community. In 2017, we actually decided that in May we wanted to welcome Leslie Subach as our new chair of OBGYN. And so we had a welcome reception instead of the forum, but we had an October forum called Gender Matters, Why Sex and Science Isn't Enough, that we did in partnership with the Population Health Sciences Center. So that really does count as one of the numbers, but we've kind of miscounted. So 2018, we prioritized prevention in women's health, and we had Kirsten Bibbins Domingo, who was the head of the U.S. Preventive Services Task Force at the time. If you're not aware, Doug Owens here from Stanford is the current chair of the task force. So Stanford is definitely playing a major role in prevention. And then this year, we've gone back to do women's global health, and we have a wonderful program. I'm going to introduce our keynote in a moment. This is in partnership, as I mentioned, with Obstetrics and Gynecology and also the Stanford Center for Innovations in Global Health. So I'm going to introduce Mary Ellsberg in one moment. I do just want to say she is very important in the whole world of violence against women and sexual assault. I actually assign her journal from The Lancet, her article from The Lancet to my health impact of sexual assault class. And there's several very important articles that she'll tell you about. But I just want to orient you. So first of all, usually you tell people where the bathrooms are, so I forgot to do that. You would go to that far end and turn. By that time, you're turning right. I have to stick my whole arm out to get right and left. But anyways, you go that way. And I don't think we have a gender neutral bathroom on this floor, but we did have a transgender symposium here where we created them, and so hopefully we'll have that. But I want to orient you that we're going to have a break after Dr. Ellsberg's talk. We're going to divide the room in half, and this is B, and that's C. So in B, you're going to have Lisa Goldthwaite and Kate Shaw will be presenting back-to-back on family planning perspective on maternal mortality, and Dr. Shaw will moderate that. So if you're interested in that, you have to make a choice of either coming back into this room. I think you're allowed to stay in this room while they put the walls up. Or if you go to C, you're going to hear Clea Sarnquist, who's my co-director, or I'm her co-director, for intersectionality, gender and intersectionality. So she's doing her presentation on intersectionality, violence, and adolescence. So with that, I'm going to introduce our keynote, and I actually think I'm going to let her have more of the time because she has so many wonderful things to say. But she's going to be, so Mary Ellsberg is the founding director of the Global Women's Institute at George Washington University and professor of global health. As I mentioned, she's very important, internationally known, and she's going to be presenting on preventing violence against women and girls, a global public health challenge.